Today we are going to discuss about another very common disease which we know as tetanus. The main culprit of this disease is Clostridium tetani. Characteristic of this disease is tonic muscular spasm, usually at the site of the infection or a wound. Very frequently it follows the injury, whether it's a trivial or it's a significant. Puncture wounds are highly vulnerable because it favors the growth of anaerobic bacillus. Sometimes the disease may be due to local separation like autogenic tetanus. It is the most common complication of a septic abortion. This is caused by where the unhatching practices are going on, such as the application of a cow dung on umbilical stem or in rituals like ear boring or ear piercing circumcision. It can also be caused by an sterile injection. The incubation period of this disease is quite variable from 2 days to several weeks. It depends upon various factors like the site and nature of the wound and toxicity of the organism and immune status of the patient. This disease is highly fatal to the neonatal. Tetanus was a very serious disease with a high rate of mortality of around 70 to 90%, but after the evolution of the specific treatment, mortality rate becomes down, but still it is very high. Tetanus neonatal and uterine tetanus are highly dangerous. This is the most common cause of newborn death in rural areas. However, this disease due to exotoxin of the organism which gets into the blood and affects the anterior horn of the spinal cord, and because of that rigidity and convulsions occur. Tetanus is very common in developing countries where the climate is warm and where the unhygienic practices are going on and with the poor medical facilities. As far as the diagnosis is concerned, diagnosis should be made on clinical grounds. However, there are some methods by which we can detect this organism through by microscope or by the culture, but however, the microscope is not very reliable because there are many types of organism which looks like tetani, so we're not able to figure out that which exactly this virus is. So the culture is quite more reliable as compared to microscope. However, if you come to the clinical feature, the most important and earliest symptom of this disease is trismus, in that the jaw muscles will get a spasm, and because of that we're not able to open the mouth, and we're not able to eat food, and because of that the patient condition is getting worse. Afterwards, this disease spreads to the face and the neck and to the trunk. In severe cases, there's a violent spasm lasting for a couple of seconds to a couple of minutes, and that is spontaneous, and it can be induced by external stimuli like moving a patient and making noise, and the very intense light. These are the stimulus by which the patient can get stimulus, and because of that it comes into intense spasm. However, if the convulsion occur soon after the first sign of rigidity, then that would be a very fatal. In less severe cases, the convulsion occur after a week, and in very mild cases, they will never appear. However, the death of the patient occurred due to aspiration pneumonia and asphyxia. If we come to the treatment part, we have to follow some guidelines. First of all, we have to control the spasm. It can be controlled by diazepam. In many cases, it has been found that it is very effective. However, we have to keep the patient in a very quiet and subdued light, because a very small stimulus can trigger the spasm. Second, we have to give the proper nutrition to the patient. If the patient is not able to take orally, then we have to give intravenously because it's a long battle. So we have to give the proper nourishment and fluid to the patient so that it will so that the patient can able to survive. And third is a prevention of the abnormal absorption of the wound. In that, we have to give intravenous injection of immune serum as soon as we suspect the disease, and we have to clean the wound thoroughly. And if we found any sort of necrotic tissue or pus, we have to drain it out as soon as possible. In prevention, we have to give active immunization to a person so that the occurrence of the disease will be down, and we have to debridement of the contaminated wounds so that the disease will not spread. So this is for now, and in our next video we are going to discuss about any other common disease. Till now, thank you and bye bye.